Hello and good afternoon, everyone. My name is Gabby, and I work as a community liaison for the Caregiver Resource Center of Orange County. Thank you so much for tuning into our live stream today. Before we get into our material, we wanted to briefly review our resources and services. A bit about the history of the Caregiver Resource Center. We've been serving Orange County since 1988. We are a program of St. Jude Community Services within Providence St. Joseph Health, Community Health and Investment. We are a part of a system of California Caregiver Resource Centers. So there are 11 across the state and one Caregiver Resource Center for every county. We are funded federally through the Older Americans Act and through the county by the Family Caregiver Support Program. So who is the Caregiver Resource Center? We are a trusted partner for Orange County families coping with the physical, emotional, and financial responsibilities of caregiving. Our center's mission is to increase the quality of life of caregivers by helping families and communities master the challenges of caregiving. Our whole goal is to make sure caregivers don't feel alone in their caregiving journey. So this is just a brief overview of our services. So we offer support groups both in person and virtually. We offer them in 3 languages, English, Vietnamese, and Spanish. We offer counseling sessions to our registered clients. Our registered clients also have access to our caregiver assessment and care planning with our family consultants. Anyone who calls our center has access to specialized information and resources across Orange County. We offer education and training and legal workshops. We had a legal workshop last Friday, and they pop up periodically throughout the year. And last but not least, we have our most popular service, which is our respite assistance program. It pays for in-home care or out-of-home care to give the caregiver respite to take that time to take a break while their loved one is being cared for. And today's live stream is all about celebrating Minority Health Awareness Month. And you might be asking yourself what that is. So we'll get into that. So what is Minority Health Awareness Month? Its purpose is to build awareness about the disproportionate burden of premature death and illness in people from racial and ethnic minority groups. It encourages action through health education, early detection, and control of disease complications. A bit about the history of Minority Health Awareness Month. The origin can be traced to 1915 with the establishment of the National Negro Health Week by Booker T. Washington. In 2002, the National Minority Health Month received support from U.S. Congress. Congress encouraged all health organizations and Americans to conduct appropriate programs and activities to promote healthfulness in minority and other communities experiencing health disparities. So these are some California health disparity statistics that we would like to share with you all. So life expectancy in California is 81 years. But for Black Californians, they have the shortest life expectancy, which is at 75.1 years. Latinx Californians were more likely to have low incomes below the federal poverty level and to report being uninsured. About 1 in 5 Latinx Californians reported not having a usual source of care and had trouble in finding a specialist. And the COVID-19 pandemic has had a disproportionate impact on some racial and ethnic groups. The COVID vaccine has not been equitably administered across the state by race and ethnicity to this day. A few more statistics that we would like to share with you all. So the chronic condition prevalence exceeded statewide averages amongst several Asian subgroups in California. 14% of Vietnamese Californians reported being diagnosed with diabetes. 32% of Filipino Californians and Japanese Californians reported being diagnosed with hypertension. 31% of Korean, South Asian, and Vietnamese Californians delayed care due to cost or lack of insurance. So the National Institute on Minority Health and Health Disparities oversees numerous programs that are essential to its mission of uncovering new knowledge that will lead to a better health for everyone. The NIMHD offers programs that are central to their mission, including research programs and education/outreach programs. If you would like to get involved or learn more, you can contact them at nimhd.nih.gov or 301-402-1366. So how are we here at the Caregiver Resource Center celebrating Minority Health Awareness Month? Here at the CRC, we like to remind caregivers of the importance of self-care and taking a break. We hand out this handout on the right often for some creative ways for caregivers to take a break. Self-care is important because it allows caregivers to actively manage their own health and well-being, leading to reduced stress, improved mood, increased energy levels, better mental resilience, and an overall enhanced ability to cope with life's challenges. So now we will be demonstrating one way you can take time for yourself as a caregiver to relax. We will be providing the same live stream in English, Spanish, and Vietnamese. Or we did offer it in Spanish and Vietnamese earlier. Our goal is to make sure our resources are accessible to all communities in Orange County. So now I would like to introduce my colleague, Jose Cueva, who is one of our family consultants. Hi, Jose. And he
Hi,
will be
Gabby.
leading us through one way you can take time for yourself with a self-care activity. Go
Thank you,
ahead.
Gabby.
Of course.
Thanks. So, in celebration of Minority Health Awareness Month, I will be guiding you through a short mindfulness meditation. This meditation consists of taking a short time in your day today to stop, breathe, and observe your thoughts and emotions without judging them. It helps us to be present and to act from a calm and relaxed state. Meditation is an ancient technique that allows us to train our mind to reach a state of calm and tranquility. It consists of focusing our attention on an object or on our own breath, letting thoughts and emotions flow without getting attached to them. And as we practice meditation, we learn to observe our thoughts without judging or identifying with them, which help us to free ourselves from stress and anxiety. The benefits of meditation are numerous and scientifically proven. These include reducing stress and anxiety, improving sleep, increasing concentration and creativity, strengthening the immune system, and regulating emotions. And in addition, meditation helps us connect with our inner selves and find a state of lasting peace and happiness. I will now guide you through a mindfulness meditation practice, and we encourage you to participate if able. So let's begin. And begin by getting in a position that makes you feel best right now. I invite you to close your eyes and begin to tune into your inner experience. Relaxing your shoulders, relaxing your hips, soft eyes, soft faces. Good. Now let's take a deep, refreshing breath through your nose and out through your mouth. Allow your breath to ease you, turning all of your attention inwards, making yourself your first priority in this moment, and only focus on your well-being. As you continue to breathe through your nose and out through your mouth, Notice the feelings of your breath weaving through your nose, throat, and out of your mouth. Notice how your body feels, your muscles and joints, feeling grounded and connected to self. You may be feeling tension in certain areas of your body. Just allow the breath to ease those areas even further. Let it go. Be aware of any judgment that might come up as you do this. Simply acknowledge that those thoughts are there and let it drift away, replacing it with loving thoughts and how your body will support you through this day. And if your mind wanders, that's okay. Just return back to your breath, breathing in through your nose and out through your mouth. Nothing to judge about your experience. Let it be perfect as it is. Whatever your experience is, it's perfect as it is. And on your next breath, breathe extra deeply, stomach and ribcage expanding fully, holding your breath whenever you reach the top. And when you're ready, let everything go with a powerful sigh. And when you reach the bottom of the exhalation, bring your breath back to your comfortable breath, comfortable pace. Feeling grounded, letting go of anything that doesn't serve you. And at this moment, thank yourself for allowing time to care for self. Thanking your body, your mind, and spirit. Enjoy this feeling. And let's move our fingers, toes, maybe rolling your shoulders, waking up the body. And when you're ready, open your eyes. Good work. Thank you for participating in today's activity. We hope this information can assist you as you remind to care for yourself.
Thank you so much, Jose, for guiding us through that meditation exercise. And again, this is just one of the many ways you can take time for yourself as a caregiver. If you would like to learn more ways to manage your stress or would like support in your caregiving journey, please don't hesitate to reach out to us. You can contact us via our number or our website. On our website, you can find more classes and live streams like the one today. And again, just thank you for joining us this afternoon. And we hope you have a beautiful rest of your day. Thank you.